Thanks for staying with us on DD India. You're watching Doctor's Chat. I'm Sakal Bhatt, and today, in the next half an hour, we're going to talk about uh, interventional cardiology, coronavirus, and COVID-19. Is there any correlation? The two big questions that we are going to examine on Doctor's Chat: that patients with any sort of underlying blood pressure problems, diabetes problems, or for that matter, heart-related complications, are they more vulnerable to coronavirus? Are they more vulnerable to COVID-19 infection? If yes, what are the specific precautionary measures that can be taken? We're going to examine that question. And also, is heart attack more likely, especially for those who are battling with some sort of heart complications or cardiovascular issues post COVID-19? Is that also a big issue? In this edition of Doctor's Chat, we're very glad to have with us Dr. Praveer Agarwal, who needs no introduction. He is Director, Fortis Escorts Heart Institute, and he's going to be talking to us about one of the most pertinent topics or issues, Dr. Agarwal, that has come to fore, especially in this amidst second wave, coronavirus impact and heart complications. So if you could just, for the benefit of our viewers, start by explaining what is the link and long COVID and heart complications, the kind of cases that have come up.
You see, ma'am, if we see in particular, initially in the first wave, the people were scared. Despite being having cardiac problems, they were not coming out. Right? They had problems inside house, and once they were reaching us, it was too late. So we convinced them through the media that they should not avoid cardiac things. And initially, if you see I would not say that like incidence has gone up. It was the same, but the people were not getting treatment in time. They were reaching late when they were really in trouble. So at that time, you know one thing in heart, treatment at right time is the key of success. If you are late, you can be managed, but you will not get the same benefit as you will get once you are treated in time. In the second wave, despite being the fiasco, like again, the people started behaving the same thing. They were hiding symptoms. They were not coming in time. And more so, as we have heard, that during COVID, the thrombotic complications were there because of COVID also and pre-existing heart disease. So that led to the whole problem. The people are coming so late. And once you come there in a COVID era, the people will start giving the right treatment once they have got the COVID report negative. We have got an example, the people sitting in the ambulances for the COVID report to come and then enter the hospital. So this was a scare all around. But now I think after the second wave has gone, people are realizing that the heart treatment is equally important and they should get the treatment in time. As you were asking that what kind of like COVID has made an impact on the cardiac problems.
Correct.
As we know, it's an inflammatory process all across the body, including heart. All muscles, all arteries, all veins, all inflammatory problems. So I think, as we explained by so many times, that you can have inflammation in the pericardium called as pericarditis, inflammation in myocardium called as myocarditis. You can have plaque ruptures, you can have acute thrombotic episodes, acute MIs, unstable angina. Name the thing is there in these patients. But I would not say this only COVID. Any kind of inflammatory process can lead to that. So all the problems were really exacerbated once the second wave was there. And when it was a peak, you would not know that how much COVID is causing the problem and how much heart is causing the problem.
That makes it very complicated.
Yes, it is. It is.
So a quick one, sir. So those already having some sort of heart complications or comorbidities pertaining to cardiovascular system could be more vulnerable to coronavirus infection?
No, ma'am.
Okay.
You see, the infection is same in all across, but they will have more symptoms. Their presentation will be more severe. Like their presentation may be like requiring admission and treatment in hospital. The majority of patients who were without risk factors, they were coming out without having admission in the hospitals. They were treated at home. But these patients are really sick once they get the infection. But I would not say they are more prone, but the presentation is more severe.
Okay, and that comes to a very simple question. That leads to a very simple question: what are the possible heart issues post COVID-19?
Ma'am, as I told you, there anything that you can think of in heart is there with COVID. Whether it's COVID or COVID related, maybe some exacerbation of the problem that we can't say. We can't say per se that COVID is causing all the cardiac problems.
Hmm.
As you know,
Hmm.
it's an inflammatory process. Inflammation means like you know that all the inflammatory markers were raised in COVID, so they will certainly affect the heart also. We have seen few patients having involvement of pericardium called as pericarditis.
Hmm.
Pericardium is the layer of the outermost layer of the heart. Then comes the muscle, it's called myocardium. Then
Hmm.
myocarditis. Again, you can have inflammation in myocardium. And we have also seen few patients with myocarditis, but fortunately, these patients do recover. They had problems when that settles down, and the myocarditis also is recovering. There are
Hmm.
very, I would say, unfortunate few that who will not recover. Like I've got, under my follow-up, I would say a couple of patients of myocarditis. Majority of them have recovered as soon as the infection has settled down.
Hmm.
Then acute complications, you must have heard the blockage problem called ischemic heart disease. All these patients are very, very stable on medication and required therapy.
Hmm.
But once they got COVID, there were more plaque ruptures, there were more acute MIs, and more thrombotic burden in these kind of patients.
Hmm.
But it's slightly more complicated once they come into picture because once you are treating a thrombus, then you need to be really very, very expert in treating these kind of lesions. But all of us have realized that it is nothing much different. Only thing is slightly more worse picture than a person in a stable condition has.
So there is no direct link. You talked about blood pressure going up and blood pressure coming down, and then uh, if you have recovered from COVID-19, there is no direct link between COVID-19 and
Because
fluctuations in blood
there are
pressure
no
levels.
studies. You see, the studies will be done later on, like they are in process, but nobody can give you clear guidelines that what's going to happen with these patients.
Hmm.
And what we have seen is, like in the routine practices, even if the BP goes up during COVID, as soon as you settle down in this maybe couple of weeks or couple of months time, it comes down to the baseline level. So nothing majorly to panic about these things. They do recover and they settle with time.
Hmm. Precautionary measures, if we could just focus on that, regular cardiac checkups. We have been battling COVID-19 since last, in fact, more than 1 year. What would you like to tell those who already are battling with some sort of heart complications?
First of all, there's no panic about the heart disease. They should continue their medication as it is prescribed. The regular checks, whether it's telephonic consult or maybe physical consult, which are on, and we have been doing like telephonic consult all through the COVID. They should not be scared. If they are called in OPD, they should come because we take enough precautions for them to be treated, right? They should
Hmm.
not be scared. They come to the hospital, they will be like caught by COVID. No, it is not like that. Everybody is screened, and the people who have no COVID, they only enter the hospital.
Hmm.
So these things are taking. They are scared to come to the hospital. Even if you call them, they will say, "Doctor, COVID ho jayega." I said, no, no,
Yes.
no, don't worry about that. Don't worry about that, and we will take enough precautions, and you will be like given a safe environment so that you don't get COVID. And where we are treating cardiac patients, the COVID is not there at all.
Hmm. Hmm. And any specific precautionary measures that you would suggest or recommend to the heart patients or who have slightest of heart problems also?
No, the precaution is only that the routine testing, the like diagnostic testing, and the therapy part, all is going just the same way. And they should not be scared that if they come to the hospital, they will get COVID. And whatever suggestions are, they should take it. And the cardiac medication is very, very important. If you just are taking any other medications, one should not stop the medication at all. And routine check as before is there. And if you have slightest of problem, you can come for the diagnosis. As I told you initially also, the earlier the treatment is good for you. If you just have the preserved heart, that's the best time to get the heart treatment done.
Hmm. Uh, so there is a sense that patients with underlying diabetes or high blood pressure are more susceptible or vulnerable at heart risk and more vulnerable to COVID infections. Would that be incorrect if we say that, or it would be correct to say that?
That will be correct, ma'am. You see, in a diabetic
Yeah.
scenario, diabetics are all slightly immune suppressed, if you see that. And
Hmm.
if somebody is immune suppressed and maybe long term hypertensive, these are all aged patients. diabetes, hypertension, all right, and heart disease. So these patients have got lower immunity, and these patients are more prone for getting infection. And more so, as I told you, that once they get infection, the presentation is more severe. So that's how they get more sicker. They more of them need more hospitalization, and a prolonged stay in hospital is on the cards once they come into hospital.
Hmm. And what would be your suggestions? You said that you should not panic, and frequent heart checkups are are very essential. But
Yes.
then the vulnerability of heart patients uh, at the risk of getting a COVID infection, COVID-19 infection, especially why I'm asking you this, we're still battling second wave, though the numbers have come down. There is a situation where we can avoid a third wave. We are working towards it, but especially in this domain, interventional cardiology and coronavirus manifestation. If you could just elaborate that space a bit.
Now, you see, as you were saying that coming to the hospital instances with this comorbid conditions will not be a good idea. But let me tell you, all the hospitals are taking enough precautions that all these patients who are more sick, like they're diabetic, hypertensive, and existing heart disease, they are not exposed to COVID at all. But suppose they reach late to us, we have got all the problems on the card, right? They need prolonged treatments, and which is not good for them, and they get more sicker. And as you know, the cardiac mortality and mortality is much higher than the COVID,
Yes. Mm.
right? The COVID, the mortality is hardly 1.5%. And if you go for cardiac acute problems, the mortality is very, very high. So
Mm.
getting a scare of COVID and not getting the right treatment in time for heart disease is not a good idea.
It's extremely challenging.
Yes, that's challenging. And it's challenge for us also. And you see, we have been working all through the COVID. And let me say, I'm lucky to did not even contracted COVID,
Hmm.
despite being like, so they say the vaccination also is safe. I got vaccinated in time, but still, I was just facing all the challenges during COVID. But the precautions were enough that I was wearing a mask. I was just sanitizing my hands time and again,
What
and I
about
was
these
very safe.
variants? The variants. Now we're talking about Delta variant, Delta plus variant,
Well,
vis-a-vis
these
the
all variants.
variants and cardiovascular interventions.
No, ma'am. There's no correlation as per the cardiac variants in the variants and the cardiac things. It's all just the same. Variants are means, ma'am, whatever vaccine you are giving, it may not be effective in that particular variant. And
Mm.
presentation of different variant is very, very different. Like as you saw, the first wave, it was not as scary as the second wave. And you never know that what the third variant is going to just give us how much trouble. So these things are just to wait and watch. And these are like studies are so small to say anything right now.
Okay.
Even the data is very, very less to just suggest that all the variants in a different society behave differently. Right.
Okay. Yes.
So the
Yes.
third variant, people are saying now, the immunologists and the guys who can treat them, they say that it might be unavoidable, but may not be as severe as the second one. May not. So they always
Mm.
write, they will not say will not. They say they may not. You means you have a chance that it may be severe.
Mm. Mm.
And you must be seeing a trend now in America. The numbers are going up again.
Yes, in America, the numbers are going up. In Australia, the numbers are going up. China, more than 11 provinces in China are having their own battles to resolve in terms of the variants that they are, dealing with as of now. But coming back to the situation in India, and we're specifically, Dr. Agarwal, talking about the cardiovascular interventions and coronavirus manifestation. Just to simplify it for the viewers, basically, when we say cardiac manifestations, the kind of impact that COVID-19 can have on heart and issues related to heart complications. In the last 1 month, especially when we were in the midst of the second wave, April and May, did you see rapid rise in the number of cases, heart cases, when the corona cases also went up, or there was no link between these
Ma'am,
two, no pattern that was found?
no pattern can be identified like that. Certainly, we had few more numbers of acute events, but I would not say that these events would not have happened if the corona was not there. So you can't have these kind of numbers that can tell you that really it got escalated. But certainly, the patient who was getting sick was really bad.
Hmm.
means the sickness was much higher than as compared to the first wave. That I will
Okay.
agree. But the only thing is that we can't say the numbers went up as the data was saying in the newspapers that the 15-20% of the patients really had a cardiac new manifestations, which I would not agree.
Okay.
You know,
Okay.
maybe the older patients who were really having cardiac problem, that they got destabilized, and they required an urgent treatment
Hmm.
rather than just putting it to the corona. That corona did all the things. But certainly, it gives you inflammation in the whole of the body, including heart, and you get more destability as compared to if you are not having the COVID situation, the pandemic situation.
And since we're talking about heart complications, type 1 heart attack, type 2 heart attack, irrespective of that.
Well, these things are very different. Type two, you say that when you got the body is more stressed and you get the heart attack because of that, because of low oxygen, because of the lung problem, and the heart has to function more, and maybe the your tachycardia is there, which is also troubling you. But these things are very difficult to, I would say, just put into category that look, these are the problems. What we
Hmm.
see as heart attack is a heart attack, right?
Hmm.
In a heart attack, any heart attack, you will have a thrombus formation. The artery will
Hmm.
be completely occluded.
True.
So whether this is a small clot or a large clot, that will not differentiate from the pre-COVID or post-COVID. But certainly, what we are seeing is the thrombotic burden is slightly more as compared to non-COVID times.
Hmm.
This is the only
Uh,
difference we can make.
okay. Dr. Agarwal, is it also applicable where we talk about the fluctuating blood pressure and hypertension patients, blood pressure going up, down, or hypertension, or stress, or anxiety?
Then again, no scientific data can be produced right now. The only thing is that we say is it's very variable. You have to observe things, and as it comes, you have to treat it.
Hmm.
So nothing much can be said that look why the BP is going up, why the BP is coming down. You've got no clue about these things. We know that all the arteries are inflamed, including the peripheral arteries, which that leads to the blood pressure going up and down. Initially, what they said that inflammation leads to dilatation, and the BP will be slightly lower as compared to what it should be.
Hmm.
But we have seen the trend; the BP is going up, right? And it's really uncontrolled for maybe few weeks or few months.
Hmm.
But certainly, once it comes down, the BP also settles down.
Hmm, hmm. Let me quickly, before I wrap it up, I want your take on the vaccine efficacy vis-a-vis the cardiovascular interventions, those who are already taking medicines, heart-related, complications, and vaccines. One has to just go ahead and have vaccines, irrespective of the treatment that one would be undergoing.
Ma'am, right now there's no study available that if you are vaccinated and you get a cardiac problem, then what will be the problem? And if you're not vaccinated, if you get a problem, then what can be the issues? But certainly, what we have seen is after vaccination, even if somebody is getting a COVID infection, the infection is mild, and majority of them are not requiring hospital admissions. So leave aside the cardiac complications. I think they will not have it once the disease is mild, even unnoticed. They're just detecting by the testing. Otherwise, they don't have much symptoms. So what we have seen is the majority of patients, I can't say every patient, but majority of patients, if you are vaccinated, the disease is milder and requiring very few admissions, very few admissions. So certainly we can say that I think cardiac wise also they must be safe. But there's no data to say that look, they did not get the cardiac problem because they were vaccinated. We can't say
Okay.
that.
Okay. And can we also not say that COVID can lead to heart complications? A COVID recovered patient, is there any connection? Somebody who's
No,
recovered,
connection is there.
can,
Like you
can,
see,
can it trigger heart complications in some
certainly it
cases?
can. It
Okay.
certainly it can. Certainly it can.
Hmm.
Like you see, any inflammation will lead to more stress in the body, and including if you have got myocarditis, if you got heart arteries getting inflamed, you have more propensity to form thrombus inside, and you can get more acute complications, thrombus, plaque rupture, and plaque. Whenever the plaque ruptures, the thrombus formation is a spontaneous process. So these all things are linked.
Hmm.
But how much is COVID and how much is non-COVID is very difficult to differentiate. And you should have an epidemiological data for that, which we don't
Okay.
have, unfortunately. It's only just a hearsay that we keep
Okay.
listening. But as a
Okay.
practitioner, I would say, as a cardiac thing, what I would see is The patient number is really maybe same, maybe few percentages more, but
Mm.
once they come to the hospital, they are more sicker than what they were in the non-COVID era.
Absolutely, absolutely. One final question, Dr. Agarwal. Uh, your message to to all the viewers, and especially those who have some sort of cardiovascular issues, and this whole COVID-19 threat looming large. What would you like to tell them?
First of all, as everybody is saying, vaccination is the key to success. People are still scared. They ask us daily the question, should we get the vaccination? I said, why did you get till now? You had the opportunity from the very beginning, and still you are asking a question. It means you're not clear in your mind. So whosoever is the turn is coming, if you take an appointment, just go for vaccination. No questions to be asked. No medicine to be stopped. Often they have queries in their mind. Should we stop the medication? No. No medication to be stopped. You go in time, get a vaccination done. It's a very, very promising, like I would say, vaccine, and both are either of them. There's no point choosing between this and that. Like all are same. Number one. Number two, routine cardiac checkups, as it was done before COVID era, they should be continued as the same as before. The cardiac medication, it helps even in COVID. One should not
Okay.
stop. It should continue as before, right? And the precaution is the key to success. That one has to take precautions. Like people are forgetting now. Again, the second wave is going away. The masks are off. Like the sanitizer is gone. Like and the parties are on. Which
Mm.
I would not say. Still, is it time to just take precautions. Once it is there in the West, we can't say that we are immune and will not get the third wave. And as the epidemiologists are saying, this can be mild, but this can be mild. This may not be mild. So the precautions are very much there. One has to take all the time, and that nothing to be scared about a cardiac thing. It is managed as before, and you will be safe if you come to a right center. Nothing to worry about, and keep yourself safe first. If you don't get a problem, we are fine. But if you get a problem, then also the treatment is there.
That's so assuring coming from Dr. Praveer Agarwal. Thank you so much for talking to us and explaining to our viewers the kind of uh, correlation that both have COVID-19 and cardiovascular interventions. Thank you very much, Dr. Praveer Agarwal, Director of Fortis Escorts Heart Institute, for joining us on Doctor's Chat. Thank you. Namaskar.
Thank you. Thank you.